Movement is life. I take care of a lot of patients in the hospital, and an existential thought that can give you a lot of dread is when you ask yourself the question, does what I do matter? Now, you might say, what do you mean? You're literally a doctor taking care of patients, saving lives, and so of course that matters, right? The patients that really make you think about whether or not what you're doing matters are the patients that are chronically ill. Most people in hospital medicine can probably relate to this patient that I'm making up, which is that patient with congestive heart failure. Perhaps they've had a stroke and they've lost function to half their body. They also have dementia, so they're only alert and oriented to themselves. And so they're basically contracted and in a bedbound state for most of the day. They're found to come in for altered mental status, so they're a little bit more confused than their already confused usual self, and they're found to have a urinary tract infection and perhaps a little bit of extra fluid on them. So you can treat these people in the acute, where you give them antibiotics for the UTI and you give them some diuresis for the heart failure, and then they get back to their baseline, which is a demented self with a contracted body, and they are bedbound, needing support for all of their activities of daily living. In the end, this is still somebody who is profoundly ill with a number of comorbidities that will most likely make them eventually have to come into the hospital again. And so I think it's important to have goals of care discussions with a patient if possible and their family members, where you want to make sure that the care that you're giving is in line with what somebody really wants in the bigger picture for their life with the limited time that they have on this planet. In other words, in this patient, for example, their dementia will progress, they're not moving, so they're continuing to get deconditioned, and so as a result, they'll eventually get weak and perhaps aspirate, and then they'll come in for aspiration pneumonia, and then you'll need to treat them in the acute, but they'll still have these comorbidities, and so they'll need to come to the hospital again and again for these lifelong limiting illnesses. We'll be able to treat this aspiration pneumonia with oxygen therapy and antibiotics. However, they'll still have these chronic comorbidities in the long run, and this will most likely lead to another indication for hospitalization in the near future. Sick is sick, and there's a lot of nuances to things. However, what I want to do is give a bit of a framework that almost anyone can use to grossly assess somebody's health status based on somebody's ability to move. The less you move, the closer you are to death, with somebody who is dead being somebody who doesn't move. The dead don't move. In a circle of life framework, when we are born, we are fragile, but we get stronger. We develop more and more movement as we get stronger, from being able to roll off of our back, to being able to crawl, to being able to stand, to walk, and eventually run. We are strong and healthy when we're able to run and do everything we want with our bodies. On the other end of life, you'll start to see people lose function. People lose the ability to run, to walk without support. They start walking with a cane, they start walking with a walker, and eventually they end up in a wheelchair. And eventually they end up bedbound. Perhaps in the bed, they might have some function initially where they can wash themselves, they can feed themselves in bed, but eventually some people will lose that function to even feed themselves and give themselves nourishment. They've lost the movement of being able to feed themselves. More and more, as they become bedbound and continue to lay more and more, they become closer to that concept of a dead person who lays forever. The less you move, the closer you are to death. I give this talk to family members who care deeply about somebody who's coming in and out of the hospital a lot, because I think it helps them think not just about the acute, but where things are going in the long term. Not just the problem directly in front of them, but overall what life will look like in a few months' time and where life is going in terms of the trajectory that we're on right now. I think it also sets expectations for what we can do in the hospital. We can fix the urinary tract infection, but ultimately, this patient who's incontinent and in diapers will remain at a high risk of developing this UTI again. Solving why somebody is incontinent and in diapers is not something that is necessarily even fixable on any time scale, let alone in the hospital. The dementia they have, which we have no cure for, the pelvic floor weakness, which happens from the immobility and deconditioning, the general weakness that they have that stops them from being able to get up and go to the bathroom because perhaps they've had a stroke and they have hemiparesis or they have paralysis of their body. These are all things that we might not be able to ever fix, let alone be something that we could fix in the hospital in the acute. And so I think it's important to have these conversations so that people know what life looks like moving forward as somebody who sees these kinds of things on a daily basis. In conclusion, if you take one thing from this video, you can grossly figure out where somebody's health is with this mantra. Movement is life. The less you move, the closer you are to death. Dead people don't move.